Hello, good morning. I'm Dr. Umar. Today our topic is delirium or encephalopathy, or simply we can call it as ICU psychosis. That means if the patient is admitted in an ICU, intensive care unit, or in the wards, they behave abnormally. They will be agitated, restless, irritable, yelling, screaming, shouting, abusing, passing urine involuntarily, and getting various sort of tremulousness. This condition is quite common. It is said that up to 11 to 42% of the hospital admission can have this sort of behavioral abnormality or change in behavior, or something you call as acute confusion state, or delirium, or encephalopathy, whatever, many names are there, alright, or organic brain syndrome, or whatever. So basically they will have lack of inattention. If you talk to them, they won't be able to complete the sentence. It will be broken, and they will be hallucinating. They will be seeing so many things like snakes or something crawling, or insect crawling over their body, and they can see the people as small, like Lilliputian hallucination, vivid, very clear visual hallucination, especially with alcoholics. All right, and they will have problem with the delusion, abnormal thoughts, and seeing something as something, an object will be interpreted as something, say ghost or something like that, and they'll have a problem with the orientation. If you ask them where he's staying right now, they'll say they'll be at home or school or somewhere else. Okay, so they'll have problem with the orientation, problem with the understanding, problem with the speech, memory, continence. That means they'll be passing urine involuntarily, and they'll have either they'll be very much agitated, like they'll be thrashing, yelling, and kicking, or sometimes they'll be mute and you'll be hyperactive. It can be hyperkinetic, very restless, or hypokinetic means patient is very relaxed and drowsy, or sometimes they can wax and wane. It's called a mixed type, both hyperactive and hyperactive coming intermittently. As you know, the causes are many, like especially if the patient had a surgery, hip surgery or a cardiac surgery, they can have this hallucination and irritability, restlessness. It's quite common. So some cases can go up to 50% of the cases. So basically this may be due to a problem in the brain itself, like a stroke or an infection of the brain, like called a meningitis or encephalitis, or in a trauma, or maybe after a fit, or during fit, or after epilepsy, okay, or any lesions like any tumors, or primary tumor, secondary tumor, vasculitis, metastasis, demyelination, many things specifically pertain to the brain that can cause this sort of delirium or encephalopathy. Okay, some stroke, less especially posterior circulation stroke, are notorious to cause irritability and restlessness. Thalamic stroke, maybe frontal lobe infarction, temporal lobe infarction, they can behave, they can present to you with irritability, restlessness, agitation, and you would think that is a primary psychiatric condition, but in fact it may be a case of a stroke or something like that, or maybe in an encephalitis, like herpes simplex encephalitis. Now you see a lot of encephalitis with varying manifestation. Okay, so basically around maybe 10% of this score of agitation may be due to problem in the brain itself, but a large chunk is not due to problem in the brain, but there's an indirect effect on the brain. Maybe if the patient has got a hypoglycemia, low sugar, the presentation patient will be irritable, restless, sweating, with a palpitation, craving for food, like that. Sometimes in elderly they may not do everything, they will be just behaving abnormally. It's called a delirium. Some people the blood sugar may be quite high, it's called hyperglycemia. That can also present with irritability, restlessness, some tremor, jerks, sometimes even fits. Okay, so similarly problem with the sodium, low sodium level, low magnesium level, low calcium level, high calcium level. Okay, or any system failures. Basically you should know that there are problems with the kidneys. If the kidney fails, some of the initial manifestation may be this sort of restless behavior. It's called a renal encephalopathy or kidney related encephalopathy. Sometimes the liver fails, and this causes a hepatic encephalopathy with the patient will have jaundice, something like a flapping tremor, irritability, restlessness, and some sort of a picking of clothes and some automatic behavior. So lung failure or respiratory failure, the respiratory, because you know that lung supplies oxygen to the brain. So if that's lost or it's impaired, the brain suffers low oxygen called hypoxic brain. The brain won't get enough blood supply to the vital structure. So patient will behave abnormally, irritability, restlessness, tremulous, falling, sometimes fit. Sometimes the lung may not be able to wash out the carbon dioxide, called a carbon dioxide narcosis. Again the person will have irritability, restlessness, seizures with the congestion of the eyes, like that. So even severe cardiac failure or any drug intoxication, there are so many drugs like antidepressant, antipsychotics, various sedative, hypnotics, and various this substance abuse, alcohol, benzodiazepines, barbiturates, many anticholinergics, many drugs. Any drug can give rise to encephalopathy or this sort of behavioral abnormality. So you should find out which drug is responsible for the encephalopathy or delirium. Similarly, there are various vitamin deficiencies like vitamin B1 deficiency, B6 deficiency, B12 deficiency, niacin deficiency, many vitamins. They can also the low level can cause this sort of a behavioral abnormality or irritability. Similarly, there are many endocrine organs in our body like pituitary gland, thyroid gland, parathyroid gland, adrenal gland. So the overwork or underwork of this organ can also give us this sort of a delirium or encephalopathy. So basically you have to find out so what is the basic cause, like whether patient is having some baseline issues like whether he had a dementia or a Parkinson's, stroke or some renal, any disease which would precipitate the encephalopathy. So you have to treat that case. Suppose your kidney is failing, you have to treat for the kidney failure. If the liver is damaged, we have to treat for the liver damage. If the lung can't ventilate properly, we have to intubate the patient or give BiPAP support or oxygen or other bronchodilators, steroid, like that. So we have to treat the basic cause. Then secondly, you have to admit the patient in the ICU, and probably we need to restrain the patient, and we should have a family member if possible with the patient. Otherwise, no, he would behave very violently, it will be difficult to manage the patient in the ICU. So probably it's a 1:1 nursing care. Sometimes the family member has to be there, and we may have to give low dose of drugs like haloperidol or quetiapine or olanzapine may have to be used in cases where you can manage patient with a normal means. Similarly, the fluid electrolyte balance has to be maintained properly. If the patient has hypoglycemia, low sugar, he should be treated with the dextrose, 25 to 50% dextrose. And similarly, there are conditions called Wernicke's encephalopathy. That means pregnant people in the first 3 months, they vomit a lot and lose all the vitamins, especially some vitamin called the thiamine. That can lead to Wernicke's encephalopathy with unsteadiness of gait, memory impairment, eye movement abnormality, behavior, sometimes fits and eye hemorrhage and all. So we have to treat with thiamine. Sometimes the behavioral abnormality may be due to a fit, either a complex partial fit or one condition called a non-convulsive status. That means patient is getting a seizure, but you are not sure because he will be walking, but he will be behaving abnormally. Something like a irritability, restless behavior. So we may have to investigate by a CT scan, MRI, EEG study, sometimes a fluid study to rule out any infections, endocrine study, vascular study, and various other blood parameters. So we have to treat whether it's we have the basic conditions, we have to treat the agitation, we have to supplement enough food, water, and whatever is required for the patient, check for the vitamin levels if required, or endocrine profile for some people, and treat for the other system failure like liver failure, cardiac failure, renal failure, or lung failure. And if any drugs are responsible for the behavioral abnormality, you have to systematically reduce or remove the particular drug which is responsible for the encephalopathy or delirium. Okay, so this is something, a small brief idea about the particular condition called delirium or encephalopathy. Okay, so I just would like to highlight that this is quite common in the population, especially in the hospital and most commonly in the ICUs, and we have to treat judiciously. We have to find out the cause and treat after understand the primary basic underlying cause, and any precipitating or aggravating or worsening factor or some drug interaction has to be understood, and if any drugs are responsible for the delirium has to be removed from that list of the drugs. So always verify which all drugs the patient is getting, whether he is getting anticholinergics like trihexyphenidyl, or the patient is getting some antidepressants, or some drugs may be causing like the levetiracetam, or he may be taking alcohol, or he must be taking alcohol and recently stopped, which should give us to a sort of encephalopathy. So we have to give thiamine in those cases also. So it's a nutshell of the delirium. So let me conclude here. So if you have any queries or questions, you may comment in the box down. Okay, thank you very much.